Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Courtney Smith. Today's episode features expert insight from Dr. Robert Gish on current HBV vaccine formulations and applying up-to-date recommendations for routine vaccination, including in special situations. This episode is part of a larger educational program titled Adult Hepatitis B Vaccination: Keys to HBV Prevention and Control. For more information about Dr. Gish and for a link to the full online educational program, including downloadable slides, please visit the link in the show notes for this episode. Now let's get started and hear what Dr. Gish has to say on this important topic.
Greetings. My name is Dr. Robert Gish. I'm the medical director for the Hepatitis B Foundation, and I'll be presenting today Adult Hepatitis B Vaccination, Current Vaccines and Vaccination Strategies. Current adult HBV vaccines include Recombavax B, which includes a hepatitis B surface antigen, Endurex B, hepatitis B surface antigen, Twinrix, containing hepatitis B surface antigen and hepatitis A antigen,
a newly approved HBV vaccine, PreHevbrio, was approved on November 30th by the FDA to prevent all known subtypes of hepatitis B in adults. It's the only approved pre-antigen hepatitis B vaccine for adults in the US. And this contains the S, pre-S2, pre-S1 surface antigen and has a robust antibody response after 2 doses.
and Heplisav B, hepatitis B surface antigen containing an immune adjuvant CpG 1018. The current adult hepatitis B vaccines have multiple schedules, including accelerated schedules. Although the 3-dose vaccine schedules conclude at month 6, what if protection is needed in 1 to 2 months, for instance, for travel to high-risk areas? The CDC recommends Twinrix, which includes hepatitis A, and Heplisav B vaccines. Here is a list for Endurex B, Twinrix, and Heplisav B with both standard and accelerated schedules in adults. Current adult HBV vaccines, where we're going to take into consideration dialysis. Recombavax HB is approved for adults on pre-dialysis or dialysis with the administration of a standard adult regimen using the 3-dose schedule at 0, 1, and 6 months with 1 ml. Endurex B is approved for adults on hemodialysis using a 4-dose series. This is a 2 ml dose at 0, 1, 2, and 6 months. The CDC recommendation for the 4-dose series for adults 19 through 59 years of age.
Now we will discuss a few head-to-head studies that align with the most recent FDA-approved hepatitis B vaccines, including PreHevbrio and Heplisav B.
We're now going to look at the PROTECT and CONSTANT studies for PreHevbrio versus Endurex B. These are 2 randomized controlled double-blind phase 3 studies in adults examining the seroprotection rate, or SPR, 4 weeks after the 3rd dose. They used a lower bound of the 95% confidence interval or difference of SPR to determine non-inferiority if greater than -5%, or statistical superiority if greater than 0%. The seroprotection rates, as you can see here with PreHevbrio, at 91%, age greater than 18, then a subgroup greater than 45 years at 89%. Compared to Endurex B, we have a 76% and 73% seroprotection rate, with a difference highlighted at 14 and 16%. The 16% was actually superior. The age 18 and older was non-inferior, and the constant group, which looked specifically at 18 to 45 years of age, was also non-inferior. In adults aged 18 to 45 years, robust antibody response was observed after 2 doses. In the PROTECT study, subgroups with chronic conditions were analyzed. Higher seroprotection rates were seen with PreHevbrio compared to Engerix-B. This is demonstrating PreHevbrio's effectiveness in older adults and adults with controlled chronic conditions. Here we have data on HBV 23. This is Heplisav-B versus Engerix-B, a randomized controlled observer-blinded phase 3 study in adults examining seroprotection rates 4 weeks after the 3rd dose, with Heplisav-B being a 2-dose series with a placebo for the 3rd dose. Across each age group, Heplisav-B was non-inferior to Engerix-B using these confidence intervals. We're looking at subgroup ages here in a table with seroprotection rates for Heplisav-B in the left group and seroprotection rates for Engerix-B in the right group. Differences are noted in the right column with the 95% confidence intervals in the parentheticals. The secondary analysis in HBV 23 is highlighted here with seroprotection rates for subgroups with different chronic conditions. In key populations, Heplisav-B demonstrated significantly higher SPRs at week 24 versus Engerix-B at week 28. The ACIP vaccination recommendations were issued just a short time ago in November of 2021. The word should receive hepatitis B vaccine is emphasized here for adults 19 to 59 years of age and adults 60 years of age or greater with risk factors for hepatitis B infection. I'll emphasize the word may receive hepatitis B vaccine in adults 60 years of age or greater without risk factors for hepatitis B. In those individuals with risk factors as listed here, chronic liver disease, infection with HIV, sexual exposure risk, blood exposure risk, current or recent injection drug use, incarceration, or travel to countries where HBV is highly endemic are those risk factors that need to be emphasized for those adults 60 years of age or greater. Here are the take-home points for today's presentation. Know your patient's hepatitis B status. Be aware of ACIP's current recommendations, including vaccinate all adults aged 19 through 59 years of age. Consider vaccinating special populations aged 60 years or greater. We have multiple vaccination options, including 2-dose, 3-dose, and for special situations, 4-dose regimens. Very high seroprotection response rates, especially with newer vaccines, including Heplisav-B and PreHevbrio, are seen. These newer vaccines demonstrate very high SPR even in patients with chronic conditions, including diabetes and obesity.
Thank you very much to Dr. Gish, and thank you to our listeners for joining us. As a reminder, to view the full program, Adult Hepatitis B Vaccination, Keys to HBV Prevention and Control, and to download the slide set associated with this discussion on the Clinical Care Options website, click on the link in the show notes. As always, thank you for listening.